just like this. So I'm bringing that right ear to my right shoulder, and you can kind of see my trap there poking out in the video.
Everyone deflates towards the end of the year. Like I feel like whatever fitness grind you've been on for the last couple months, whatever fitness grind you started the year on, you're not ending the year that way.
When you do have a disc herniation, there's irritation to the actual tissue itself. So the surrounding musculature is going to get super, super tense because your body's responding to all that.
Obviously, at our practice, a lot of the treatments that we do involve a little bit of time, involve a little bit of consistency. But today I've got a couple questions that are going to be more things that can give us a little bit of faster relief. So to start us off, are there any specific stretches that can provide that fast relief for neck and for shoulder tension?
Yeah, and this is a really common one, especially with jobs that require a lot of sitting, like IT, any desk job really with posture there, a lot of neck and shoulder tension or tightness. So I'll say that the two that I really go to, actually three that I go to here, is one, doorway pec stretches. That's really big, just to open up the chest cavity here. I know a lot of people, when we get tired, our body naturally goes to that rounded position. That puts a lot of pressure on your thoracic spine. So going up to a doorway, placing your arms on either side there, leaning in with your body weight and holding for that 30 seconds to a minute can be really effective. Next, trap and levator scap are the other two, and they're very similar. So I'm going to bring my arm. So say I'm stretching out my left trap here. I'm going to bring my left arm behind my back. And I'm going to pull with my head here, and I'll show you here real quick. Just like this. So I'm bringing that right ear to my right shoulder, and you can kind of see my trap there poking out in the video. And levator scap is very similar, so I'm still stretching my left side here. I'm just rotating my head to the right a little bit, and I'm imagining my chin into my armpit here. So just like this here. Similar stretch, you're going to get some trap fibers in it, but it's more specific to that levator scap. And if you're really feeling like you're not feeling too much of the stretch, you can bring that shoulder down just a tad and you'll feel more tension. So very little amount of movement there. Hold that stretch for 30 seconds to a minute. Do all these stretches bilateral and you should feel some relief.
That was a very informative answer for us, Dr. Brady. And everybody at home, if that was a little too fast for you, we do have other videos that go a little bit more in depth as well. So make sure you like and subscribe the channel so you can find those videos a little bit easier and be able to attack your pains a little bit better. But let's shift channels to talking about sciatic nerve pain, another very common one. Are there some quick and effective ways that we can manage that pain for our sciatica?
Yeah, and for those of you that don't know, sciatica can originate in the glute. That's probably the most popular that we see here. Any compression to that sciatic nerve with that radiation that goes down the leg, sometimes all the way to the foot. And it honestly depends on where you're at in the process. If it's an acute flare-up type thing, we would obviously recommend stuff like ice for like 20 minutes at a time every couple hours. But if it's a chronic issue, want to bring blood flow to that area, then we'd recommend heat for 20 minutes every few hours. So it all depends on the timing and where you're at with the pain. Obviously, the best thing would be come into the office. We have things like dry needling, some soft tissue work that we can do to that area, and some adjustments. But at-home exercises, Mike, would be nerve flossing. So there's a couple ways that we can floss that sciatic nerve. And we have videos on our YouTube channel if you want to check that out about how to floss that sciatic nerve. So that's where I would start in the most effective exercise for that.
Perfect. Now, let's go ahead and talk about self-massaging. Obviously, in the office, we have two masseuses, but for those of us at home who are trying to do a little bit more in the self-massage, what can we really do to kind of quickly relieve and alleviate, muscle knots or, just that tightness that we kind of get?
Yeah, also another really good question. So I'll say, the stretches, I would do those first that I talked about earlier in this video, and then after your body's warmed up there with those stretches, just run through that routine of those 3 stretches. It should take you a couple minutes, like 5 minutes there. The other thing I would do, instead of like self-massaging and using your thumbs and getting into those specific areas, it's kind of hard to do in yourself. I would really recommend like a lacrosse ball or trigger point ball there, and just take it up against the wall here. And then wherever you're feeling those trigger points or knots in the muscle, use your body weight to your advantage there. And I want you to compress up against that wall in the lacrosse ball, and then just roll out those muscles until you feel them relieve with the tension there.
Gotcha. Now, what about a very sudden onset episode of pain, or a flare up, specifically with back pain? What would be the best way for us to attack that?
Yeah, so this is another thing I hear a lot. People come in, they're like, "Oh, this happened 2-3 weeks ago. I was in a lot of pain, so I didn't want to make it worse." So that's actually what we don't want to happen. We want to come and see you right away. Same day if possible. So say you're out shoveling snow here lately, as you know, we've got these 3 to 5 inches here on the ground. Come in that same day. We can use modalities here. It doesn't necessarily mean that we're going to do the typical like spinal manipulations. We'll do a thorough exam to see if that's possible that same day, but we have other modalities like dry needling, shockwave, laser, traction. It all depends on the certain condition. But yeah, get in here as soon as possible, and then we'll develop a treatment plan and go from there.
Are you going to change what you're doing in the gym for your little 75-day hard?
Yeah, it's going to change radically, actually. So from a lifting standpoint, no. I'm going to be running a 5-day split where day 1 is shoulders and traps, day 2 is all legs, day 3 is going to be chest and abdominals, day 4 is going to be back, and day 5 is going to be my arms. And I'm going to have like kind of a cross trainer day on the 6th day, and then the 7th day is going to be pretty much exclusively outdoor. But I don't do any cardiovascular work at all right now, so that's going to be a dramatic change for me. I hate cardio.
You can do active recovery day?
Nah, I'm pretty much just going to send it the whole week. Send it the whole week. I don't advise that for everybody, but I'm going to send it the full time.
Go crazy. Oh my gosh. I'm trying to debate if I want to walk or run at break.
Definitely run.
Run?
Walking is not always exercise.
45?
For 45 minutes, you better believe it.
Oh my gosh. What inspired the office to do this whole 75-day hard?
Shoot,
Or was it just like a random...
Ooh, I'm just going to say a competitive spirit. I think, okay, well, it's the end of the year. Everyone deflates towards the end of the year. Like I feel like whatever fitness grind you've been on for the last couple months, whatever fitness grind you started the year on, you're not ending the year that way, typically. So I think we're all sick and tired of staring in the mirror, seeing what we see, and we're competitive, and we're going to use the in-body scanner to track our progress. And so there's a massive accountability component to it, and that's exciting for everybody.
Yeah, if you cheat, we'll know.
Oh yeah.
Your practice, who do you guys help?
It's so much diversity. Ages all across the lifespan, children, adolescents, and every mental health disorder or diagnoses you could think of, and just life and relationship issues.
Okay. I sometimes like the way I describe it in my caveman layman terms that I understand relative to mental health, because it is such a wonderful world, and the intricacies of it I don't truly understand, but I kind of in my kind of jock meathead type of way, I say it's kind of like going to the gym for your brain, like when I discuss it with some of my patients, and if you look at it that way relative to some of the things that I see in the office, I think it's a really nice leeway into like being really comfortable with using it as a resource relative to growth, right? And then also you discuss some diagnoses as well as different things that people come in to see you with. So I love that. And then, are you in person or are you online?
We're both now.
Both
yeah.
now.
We're you guys are Suite 300 and we are now 407.
So you used to work over there above me when I was so you were in the 4th with Tori and her group, and now you're renting space from her and using that for the interns coming in here as well as being here in our office, correct?
Yes.
And she's been pretty awesome in that journey as well. So shout out to you, Tori, and the group that you have. And so it's been great to get to see you in the office a little bit more. And we are talking about, I wanted to introduce you to her, and really just kind of just so appreciative of what she does for her employees that work with her, as well as how she handles herself from a professional capacity. So I just wanted to speak to that first. And then we're here to talk a little bit about the mind-body connection.
Yeah, our professions of chiropractic and mental health overlap a lot.
Mm-hmm.
People with chronic pain that can be very mentally challenging, right?
Very much so.
Vice versa. A lot of people that are struggling with mental health issues could really tap into what's going on in their body.
Yeah, it's a natural connection that we have relative to just the work that we do, and so there's definitely a crossover. And I was saying that to one of your interns. I said, just know, like, my patients are your patients, and there's a lot of crossover as it relates to that. And so I'm here to learn from you a little bit, so I can better serve my patients, and I hope that people can understand just how they can bridge that mind-body connection a little bit better to serve themselves in this process. So that is what we're going to do. So let's start with some questions. What do you say?
Yes.
Okay. I will. Ladies first.
All right, Warren.
Yes.
Can you share insights on... No, that's my question.
I'm not taking
Instead, can you discuss the role of nutrition in promoting a healthy mind and body?
Yeah, I'll go to the extreme. And by the way, I didn't go to the club last night. It was just a younger patient gave me a star for the work that we did today. So just if you're wondering why I'm just got this going on. I go back to, like, the first thing I thought about was kind of more on the extreme. I was in St. Louis, and my friend was working for an orthopedic surgeon there, and that orthopedic surgeon was talking about if he was going to do surgery on that person's shoulder, they said that they had to stop smoking in order for him to do it because his rates of success went up so high. So that's more on the extreme side of things. Now, like, day to day, I'm dealing with people with disc injuries and inflammation, sprains, strains, but we don't tie in the role of nutrition or even some of the vices that are out there often, because it doesn't I don't have that cultural authority, if you will, or that's just not the way that we do things here on a regular basis, but it should be a huge part of it. And so nutrition plays a huge role in the inflammatory process and for people to recover a lot faster. So if you can lean in just to that thought process of taking care of yourself through a problem, not just in a movement sense, like you might see my role as, but in a nutritional sense, your rates of success will go up. And then just like from a system standpoint, your systems all across the board will be functioning better so that you can let your body do what it's designed to do, which is kind of heal from that injury. So nutrition's massively important.
Same in mental health.
Yeah,
I mean, it's a question you cannot avoid when first meeting someone. It's just, what does your diet and lifestyle look like? Because ultimately, that's going to impact mental health. If you're not eating well or have a high sugar diet, I would imagine that you're not feeling super full of energy, and it's going to play into mental health too.
Yeah. And being, like, realistic about what goals relative to that stuff too. I try to be just real with people. Like, all right, what's achievable? Where are you at? And, like, have a little fun if that's the case, if, like, that's something that you like, relatively speaking. But just trying to find a better balance towards that approach is where I like to start. Some people are like, no, I'm all in. I'm doing X, Y, and Z. We're going to war on this. I'm like, okay, all right, you're going to have some great results, I think, right?
Yeah.
So, like, finding that balance too is important, and kind of letting yourself have that balance and appreciating that, so you're not, like, feeling a sense of guilt with what you like to have fun with sometimes, right? Whether it's like for me personally, I like a little ice cream. Okay.
Right. Oh, I'm not saying no ice cream.
Oh, thank goodness.
Just, not breakfast, lunch, and dinner.
Scarlett would like that.
Yeah, so we have to teach her
Yes.
about nutrition.
That's a whole nother topic.
Our 2.5-year-old.
Yeah. All right. So you asked a question. My turn.
Yeah.
All right. Can you share the insights on the benefits of mindfulness practices in conjunction with chiropractic care?
Yes. Just in general, mindfulness is the practice of bringing your attention back to the present moment and being aware of what's going on in your mind, in your body, around you. And so benefits of mindfulness in general are just being more present, which oftentimes when you are more present, you are less in your head, less time to ruminate, have anxious thoughts, depressive thoughts, whatever that might look like, but also less time to be in your body, ruminating on how you might feel or pain you might be experiencing. So mindfulness is a great practice in conjunction with chiropractic because it ultimately will help people refocus their energy on what's going on around them and bring it away from things that could be ailing them and not helping in the moment.
Yes. Like sometimes I come home and I'm like, oh, I'm tired. And then I say it again, I'm tired. And then I'm like watching my wife just get work done around me when she's probably had a longer day than me. And I'm like, well, wait a minute. I've got food in front of me and I've got my kids to spend time with, right? Or I need to put my phone away so that like I don't have this feeling of being drained by just kind of this stimulus, whatever it is. So I can appreciate the sense of presence and what it does from our mindfulness, what it does for just overall health with your body as well as with your headspace. And
and not to validate that you may really be tired, but it's just the thought of not getting stuck in that thought process and mindset, because it's not we're not going to bed until our kids go to bed, for example. And so thinking about it and ruminating on it and letting it distract you from the present moment is not really going to help.
Many people, including myself, don't really know what the difference is. So what is the difference between a bulging disc and a herniated disc?
Yeah, so I get that question a lot. Bulging disc is less severe. So if you think about disc herniations, it's kind of an umbrella term. So you have a disc protrusion, and then you have a disc extrusion, and then you have a sequestration. So those are all basically levels there. Disc bulge is kind of like the precursor there. So the disc material doesn't really leak out as much as the other three that I just mentioned there, and sometimes does not have like a spinal cord compression or nerve root compression.
What are common causes of a bulging or herniated disc? Like, how can I get a herniated disc?
Yeah, so age definitely plays a factor in that as well. Degeneration, any chronic injuries to the lumbar spine makes you more prone to these type of injuries. And then acute trauma, lifting injuries, that's a pretty frequent one. Field hockey, volleyball. Yeah, so any like activity where you're loading or the resistance comes down from the ground there, and your back's not in that good position, or you have weak core musculature not to support your lumbar spine, you're at a more increased chance of this happening to you.
Interesting. Okay, so if I suspect that somebody or myself has a herniated bulging disc, how can I find out that I have one? Like, how is it diagnosed?
Yeah, so come to Kalkstein Chiropractic. We'll go through range of motion exercises and get an idea where you're at there. And then from there, we do muscle strength testing is a big one in the office. Other orthopedic exams like straight leg raise, slump tests. There's exams specific for disc herniations so that if they're positive, we can diagnose. And MRI is definitely a big factor of that as well. That will tell the severity, whether it's a bulge, protrusion, sequestration. So yeah, through examinations, orthopedic exams, and imaging.
So chiropractic adjustments can help with the bulging disc.
Definitely. And not only that, like the modalities that we use here as well, when you do have a disc herniation, there's irritation to the actual tissue itself. So the surrounding musculature is going to get super, super tense because your body's responding to all that increase in inflammation and that injury to the disc itself. So dry needling definitely helps. Traction therapy or spinal decompression therapy is a really big one for our disc patients. That provides space in those foramen to allow other nutrients and blood flow to help heal that disc there. And then once we get you calmed down enough, we'll start introducing other things like core strengthening exercises and back strengthening exercises so you can prevent this in the future.
Now, Sabrina, what is the Functional Strength Program?
It's a 12-week, fully customized strength program built around each individual. Typically what we do, we start with an in-body. We'll gather data on body composition just to get a better understanding of what your weight is made up of. And then we'll get into a functional movement screen, see how or where you move improperly, and then we'll take that information and then put together a program for you.
Sounds fantastic. Now, Sabrina, who can benefit from our Functional Strength Program?
Really anyone, whether it's athletes, the older population, if you're just getting into fitness. It really depends on your goals, whether it's to build muscle mass, lose fat, just just get into fitness in general. It's fitting for everyone.
That's fantastic. Now, how often would an individual partake in the functional strength program?
Because our program is 12 weeks, typically they'll come in twice a week for 60 minutes.
Nice. Sounds great. And Sabrina, would you say that the functional strength program is suitable for all fitness levels?
Oh yeah, definitely. Suitable for all fitness levels, depending on who you are. We modify each program. It's designed for you, so everything is going to look a little different. When you look on the exercise floor, you'll see someone doing heavier lifts, or someone's just working more on a rehab exercise if they're dealing with any injuries. So it's going to look different for everyone, but yes, suitable for all fitness levels.
It's a fantastic way to put it. Would you say that our functional strength program can be paired with other forms of exercise?
Definitely. Our strength program can be paired with endurance training, yoga. It's better to cross-train for sure for overall health because there's different benefits between each one. Strength training is good for building muscle, increasing your bone density. Endurance, good for cardiovascular health. Yoga is great for balance and flexibility. So there's definitely benefits from that.
Yeah, absolutely fantastic. Now, Sabrina, what does a typical session in the functional strength program look like?
So you'll come in, you'll get a good warm-up in, then we'll go into some movement prep, followed by 2 circuits, usually full body for each of those circuits.
Makes sense. Now, what advice would you give to someone considering joining our functional strength program?
So if you're considering joining our functional strength program, just know that everything is going to look differently depending on the person. So don't be afraid to start your healthy lifestyle. Come in and get after it.
Come get after it.